Hello, everybody. Welcome to another edition of the Ibarra Exchange. We are talking about talk with our new psychologist, Alejandro Ibarra from Spain, and me, Luigi. I'm a neuroscientist living in New York. We're both originally from Venezuela. Happy Father's Day. And today we're going to talk about talking teenagers. It's going to be part one. We're going to do part two next week. This is a very, very controversial, very heavily loaded content-wise topic. How's everything going, Alejandro?
Thank you, Luigi, for having me. How are you doing? Today we are going to talk about OCD and teenagers. That is a very interesting topic in OCD.
Absolutely. Obsessive compulsive disorder, we also knowing as TOC in Spanish, trastorno obsesivo compulsivo. So last week, in the last episode of the Ibarra Exchange, we mentioned that OCD, just like COVID, they don't discriminate against anybody, race, religion, sexual orientation, and age. Now we know children can have OCD, teenagers too. Do you see any difference between a male and a female teenager experiencing this disorder, this obsessive compulsive disorder?
Really, there is no a big difference between the age or between the gender in teenagers. No, doesn't matter if the person is or male or female. The most important thing is to identify all the symptoms very earlier or very faster to find the right therapies and to find the right treatment. That is the most important thing in this kind of topic.
And how big of a role does technology play? Because I'm thinking, okay, for men and women, it's not the same being in 2020 than in 1995, where you can text someone via Facebook, get answer on Instagram, send an email, get answer a WhatsApp, send something via Twitter, get answer through the YouTube website. There's always more apps, there's always more content, there's always more devices, updates. You can live your entire life in Netflix with all the content they have. How can a teenager get benefit from the use of technology, or does technology actually endangers and disrupt them even more because of all the other extra things they have that teenagers in 1995 didn't?
Definitely, the technologies has improved the quality of life in all the OCD population and OCD community. Why? Because technologies can help to the people to identify the symptoms. Some people that is suffering maybe for example in Miami, and he or she doesn't understand what happened with his or her mind. What about my symptoms? What about my kind of thoughts or my compulsions? So the technologies can put near to the right treatment this kind of OCD community. And this is very important because technology is the present and part of the future. In 1995, we don't have maybe internet, or we don't have as much or as well websites, okay, or we don't use some apps that we are working with this right now at this moment. So when some people that lives in another countries, or some teenagers around 12 years old until 17 or 18 years old contact to me through a mail, an email, or my website, definitely is a right thing, because this person is suffering and is looking for or seeking the solution to solve the problem. And that is thankful to internet, or thankful to a website, or thankful to a Google. So that is a very important point, because Google maybe is your friend until it don't help to you. Why? Because Google is one of the most dangerous reassurance seeking in OCD. People is continue doing compulsions, reassurance seeking, or seeking what happened to my mind, or what happened with this kind of behavior. So that is very dangerous, because reassurance seeking is the most dangerous of all the compulsions. That is the truth.
So Dr. Google is a double-edged sword. It can help you with the information. It can help a teenager suffering with OCD with the information and to learn more about them, but it can also be created as a tool, as a way of causing the disruptive cycle compulsion, the disruptive thought compulsion cycle. So in a way, you're telling me that a teenager suffering from OCD can spend a lot of their hours, their rituals can be learning and finding information about OCD and about things that they're suffering in their teenager, where the brain is developing, and maybe they're having, second thoughts about their sexual orientation, about their own gender, their sexuality. Are you saying that this is possible?
It's possible when you use Google as not the right tools or the right skill. Why? Because Google is not exactly your friend. Google can help you to identify some symptoms. For example, I'm suffering some thoughts or some behavioral compulsions, or what if I can hurt someone, or what if I am gay, or what if I'm transgender, what if is the typical thought in OCD community. So Google can help you, but in this moment, Google is very dangerous. Why? Because most of the compulsions can make through Google, about reassurance seeking, or about avoidance, that is another kind of compulsions, or open and close some apps through Google, for example, to check and rechecking some information, or rechecking some sensation, body sensation that is in Google information. So that is very important and very dangerous, because Google is not your friend. Google is not your psychologist or your OCD specialist. Google is not a doctor. Google is not anything. Google is only a tool.
And not even the information that we can see on .com or websites, or like anything that is not .org, org or .edu. It's not necessarily like right or correct information. But when we spoke about the difference between genders, talk me a little bit more about your practice, about the teenagers that you do. Let's start with the female teenagers. How can you recognize when a female teenager is actually suffering from obsessive compulsive disorder and not from body dysphoric disorder, where they spend a lot of their hours throughout the day checking every angle of their face, every angle of their body, seeing themselves as maybe less attractive, less appealing, or overweight that's not there. Also with anorexia, how do you know when it's OCD and not an eating disorder? Because bulimic also has cycles of eat and binge. So you could argue that there is an OCD factor in bulimia.
Yes, that is a really good question, because some of the OCD sufferers can have a 30% of the symptoms in comorbidity with another disorder. For example, depression, or GAD, or PTSD, or some of eating or eat disorder. So we, the specialized psychologists, we have to do the difference between two diagnoses to do the right treatment. So the frequency of the obsession, of the symptom, the intensity, and the duration of the symptoms can make me a perspective about if it's OCD disorder or not. Okay, so that is the difference, because OCD is OCD. It's not eating disorder, it's not PTSD. The symptoms are, remember, and don't forget that the symptoms are ego dystonic. So that is a really big difference between OCD and another kind of mental disorder or mental illness.
But some disorders, some psychological disorders are also have ego dystonic symptoms that bother the patient. A teenager can suffer from ADHD at the same time and not being able to focus. How can you say when it's actually, I mean, unless they're suffering from both of them, but if you're in class and you're experiencing these thoughts, these rituals, it's very, very easy to get distracted. How do you know that if the medical doctor or the, as you, the licensed specialized psychologist and clinician doesn't make a mistake and diagnoses them as ADHD, or maybe diagnoses them as a generalized anxiety disorder or just some sort of a anxiety?
Many psychologists in the world, in all the world, through the world, make some mistakes in the diagnosis. That is a truth. That is the reality in the psychologies, in the modern psychologies. So one of the most important things is to do a right diagnosis and to do what is the cycle and what is the mechanism in OCD, because OCD is OCD. That is very unique, very particularly, very specific, the symptoms, and are a big difference between GAD, because GAD is a worried about something, but it's not OCD. And the level of the intensity in the anxiety, in the anger, in the guilty is very high or higher in OCD comparing with GAD or comparing with PTSD. And there is some difference between OCD and another disorder, another mental illness.
I see. So in GAD, when they have this constant worry, they have these disruptive thoughts, they don't necessarily need to do an action, a compulsion, in order to release the stress of the thought. When we talk about PTSD, they tend to be more of a flashbacks, more of a leading moments, more of of traumatic episodes, much more disruptive thoughts. Also doesn't need a compulsion. Same with ADHD. You can have disruptive thoughts. You can have not pay attention in class, not pay attention in anything, get easily distracted, but not going through the maze, going through the jail, the trap, the psychological prison that a teenager suffering from OCD might have. So let's talk about male teenagers. How do you differentiate a male teenager that they play soccer or football or baseball 5 to 10 hours a day with other people and then by themselves, trying to perfect or master a specific skill? How do you recognize a teenager that maybe spends a lot of hours throughout the day masturbating constantly, or a teenager learning how to play guitar, learning how to play piano, and spending from the time they get out of school till the sunrise of the next day before going to school just playing the guitar, playing the piano? How do you recognize that in a male teenager those three are not OCD? Because at the end, music, ejaculating, sports, does releases endorphins, does releases some sort of pleasure in these in teenagers. How do they know it's a pathology?
Once again, the thing is the level in anxiety, the level in anger, in guilty, in some emotions that are not positive to the person that suffered this kind of disorder. And once again, the difference is because in OCD, the compulsion is a behavior, a repetitive behavior that sufferer has to do every day, many hours a day, many same compulsions, same kind of behaviors, in order to reduce the effects that the thought can cause in the mind of the person that suffered. And OCD is OCD. The difference are between in anxiety, in levels of anxiety that is very high, and the compulsions. Compulsions always are behaviors that are repetitive, but not just behavior. The compulsions maybe in many cases can be mental, like reassurance seeking, like checking and rechecking, mental, or praying many hours a day, or counting some numbers or many numbers in the same order. They are kind of mental compulsion. So a person that is playing soccer, playing a guitar, and that is practicing to put the ball into the basket, for example, they are not suffering that, they are enjoying this kind of playing or this kind of activity. So in OCD, it's not a way to enjoy. Okay, the person that lives with OCD, remember that OCD is a very debilitating disorder. So the person is suffering all the day, every day, many hours a day. So it's a big difference between OCD and many other disorders.
So it's not just the time that they're investing, it's the fact that they don't have control of the cycles of the behaviors that they're doing. So whether you have a teenager playing sports, playing music, masturbating, or a female teenager, looking themselves in the mirror, any teenager spending a lot of time in Google or in the website looking for information, it's the lack of OCD is more when they lack the control to actually get out of the maze, get out of the prison that they put to themselves. And they have this high level of anxiety that shouldn't be normal when they're doing activities that should be pleasure seeking and
Exactly.
more.
Absolutely.
So it's not just the time quantity, but the control and the strength that they are suffering. Let's ask a last question regarding the parents. How much of a role do parents of a teenager with OCD plays? Do they get to be in practice? Should they play a bigger role? Should they play a less annoying, obnoxious role? Because when you have the developing brain, all the changes that are happening at the neuronal level that continue to happen even after they're 21, I don't imagine having the extra layer of stress of one or two parents, and maybe their religious beliefs, the mental health stigma, even adding more anxiety and problems to the already bad situation.
Yes, the role of the families are not always very positive. Depends on the family. Are families that contributed or help to the sufferer to put in the right treatment, and some families doesn't understand what happened with the sufferer, doesn't understand the OCD cycle, doesn't understand the mental illness, doesn't understand what is the difference between a depression, between PTSD, or between OCD. So depends on the family, the roles can be active or passive. In our practice office, we try to work with some families at the final or the end of each session, about 10 or 15 minutes, in order to help to the family to understand the symptoms, to understand the cycle, and to help to the sufferer, he or she, to do the work exposure or workbook or work to exposure to homework. That is a big role and very important. Why? Because exposure with response prevention need to do with frequently. And this kind of therapy works with homework. So the family plays a very important role. So when families definitely doesn't understand the cycles, so we try to just work with the sufferer, not with the family.
Right.
In our practice office, we try to put all the information to the family, to the parents, to the family, but depends if the family can understand this or not understand at all the information. That is a really big problem in some cases, in some families. But the most important thing is to do the work with the sufferer. That is the key. That is the key of the success in the treatment. Do the work with the sufferer, with my clients, with my person.
In this case, with the teenager.
Yes, exactly. In this case.
It's definitely a very controversial and heavy topic. We're going to leave it there for this week, but we're definitely going to continue next week on the Ibarra Exchange to talk about OCD in teenagers, part 2. Thank you very much, psychologist Alejandro Ibarra, for joining us from Spain.
Thank you, Luigi, for having me every Sunday. And next Sunday, we continue to the part 2 with OCD and teenager. Thank you. Thank you for your time.
Absolutely. Happy Father's Day. Thank you.
Thank you. See you. Bye-bye.